The most awaited and coveted awards evening in the healthcare sector, the 16th edition of FICCI's annual Healthcare Excellence Awards. The awards, instituted in 2009, recognized the individuals and organizations for their commitment and dedication, their exemplary contribution and innovative work and transformations in the healthcare sector. For FICCI Healthcare Excellence Award 2024, Ernst & Young EY is the official tabulator and Astron Healthcare is the supporting partner for these awards. We request you to kindly settle in as soon as possible. Our chief guest is going to arrive in a short while from now. And before that, I would welcome on days Dr. Y.P. Bhatia, Chair FICCI Healthcare Awards Core Group, Chairman and MD, Astron Group, to kindly give a brief note on the FICCI Healthcare Excellence Award 2024. Welcome, sir. Over to you.
Good evening, friends, ladies and gentlemen. It's a privilege to welcome you all to this 16th edition of FICCI Healthcare Awards. It's something like an annual celebration. I have the privilege of being associated with the awards right from the time these were incepted about 16 years back. Of course, we are missing today our colleague, Dr. Narottam Puri. In fact, between him and me, we worked out in this idea that there are a lot of awards, a lot of activities happening in the industry, but what we lack is the most credible awards. And the effort started to start a program which recognizes the institutions, which recognize the individuals who have done such a tremendous amount of work to bring healthcare to the standard what it is today. I've maintained that we have been going through one of the biggest transition of healthcare systems in the country in the last couple of decades. In fact, what I remember 1989-90 when I worked on the first hospital project after coming back from States. We hardly had anything. Even if we wanted to plan a hospital with an excellent infrastructure, the material was not available. The availability of resources was so limited. Even just to get a vinyl floor for the hospital, it was practically impossible to get. We had to import it. Forget about the equipment, which was such a difficult thing to have. The practices were far and few. And from there, what we have transitioned into a state today, when the best in the world is competing with us, or we are competing with the best in the world. I'm saying the best in the world is competing with us with the strong intent that people across the globe look forward to us for the practices, for what we did. And in fact, one of the events today, we said that we are proud of producing the best human resource in the world. And we have to be proud of doing the best activities in the world also in the healthcare, and we have to reach that level. And many players across the industry, they have helped us to do that. In between, what we lacked was the standardization. And we have luminaries in the industry who helped us to create that standardization. I remember the journey. I think it was somewhere around 2001 or so, when we started going abroad to promote medical tourism. Everyone in the industry, from every major industry, we were together. And whichever country we visited, we went to Dubai, we went to Abu Dhabi, we went to other places. The first question in the meeting, we were asked what kind of accreditation we have. And we were very sheepishly trying to tell them, ISO hai, hamare paas, ye hai. And within 5 minutes, you realize that all the senior people from the room, they have already left because they just want you to have a cup of tea and leave. And that's from where the industry exercise started. Why not put Indian system into a pedestal and start working on the accreditation process. A task force created, action started, and 3 years down the line, we had created a draft standard with almost 1,400 pages document, which was assembled together, not knowing what to do with that document. That's the time we went across and tried to find out what should happen. And that's the time we came to know about Quality Council of India. And we met Mr. Gyani and handed over that document. And that's how the NABH came. And in 2006, we had the NABH, which now Pawan would remember. He was the first chair of the technical committee of the accreditation system. So from that time, and the whole thought process came, 2006, that happened, and around 2008, when a lot of hospitals, they started practicing the, I won't say modern system of medicine, the evidence-based system of medicine, but evidence-based quality systems also. We sat across and we thought that why not have industry-specific awards? And this FICCI Healthcare Awards got initiated. We have a very rugged mechanism of how we go for it. In fact, I have been associated right from the time it started, and my organization, Astron, has been brought in at 2000, for the last 11 years, where we started with a process of nomination. And the whole nomination process goes through a process of diligence. It's a broad-based, an interim jury looks into it, a final jury looks into it with all the presentations, and then but 2011, what change we brought in was, we brought in the process of validation 11 years back, where all the claims which was being put by the people who apply for the awards, after the interim jury, whosoever is shortlisted, there is a process of validation. And this is probably makes these awards very different from the other awards in the industry. Applicant may be sitting in a remote corner of the country, but still there is a validation team which visits that. In fact, we remember 2 years back, one of the participants, a eye center, was actually operating from a very remote village of Gujarat, where our team had to travel almost 200 kilometers through the rural areas to reach the tribal belt. And they won the award because they had done the job, which probably people sitting in the urban sector also cannot do it. Similarly, we go ahead and recognize some of the individuals who have contributed largely to the society, largely to the development of the healthcare industry. The award for lifetime achievement, the award for the yearly performance of the year, and last 2 years, we realized that there are other awards which need to be, there are other people who deserve the place, but at the same time, it's difficult to accommodate. So the Chairman's Award was introduced 2 years back, and for the last 2 years, we have the Chairman's Excellence Award also, which has been introduced into the system. So ladies and gentlemen, I think this is a brief history, how this awards started, how these award events goes on, and what the process which we follow for making this award, and who makes it happen. It's all of you. Practically, we get about 200 plus nominations every year. And our colleagues at ENY, they in fact check the validity of all the applications which come across. Whatever claims have been put across, at least a initial validation at that time is held. And then we have the interim jury. We are really grateful to people from the interim jury who contribute their time, because that's probably the most difficult process that we have. 200 applications to be shortlisted to 4 or 5 in each category. And I can tell you, most of the people who finally apply for this, they are the best practices in the industry which have been put together. So choosing that 5 in each category out of so many of them is a huge task which has to be performed, which has to be done by the interim jury. And my grateful thanks to everyone who's contributed that much time to go through each application so kind of diligently to make that shortlist. And that follows the process of the final jury. I'm grateful to Mr. C.K. Mishra, who has been heading over final jury for last couple of years, and all the members of the final jury, where each organization is required to make a presentation of 10 minutes, and all the grand jury members are able to kind of get across to them, get clarifications, get what they want to do, so that ultimately one has to be chosen. And all others who are there, who also happen to be the best, say out of 5, you have to choose one and reach a conclusion. So again, very, very grateful, thanks to the people from the grand jury. Some of them have been there with us for years together. Some of them, of course, we keep on adding every year. There's some new faces who come across. In fact, for each category, which you'll see right now, there is a separate set of grand jury people. So at the end of it, there are more than 20 people who get associate the grand jury and more than 20 people who get for the interim jury to make it happen. So that's where we finally reach. That's where we are finally able to present you the award today. So ladies and gentlemen, thank you so much for hearing me to brief you on how we reach this process. And now we'll invite ANY people to actually give you the structure of how the award process goes through before the actual award function starts.
Thank you so much, sir, for your informative address. As EY is the official tabulator of the awards, I now invite Ms. Sakshi Kishnani, Director, EY, to briefly explain about the evaluation criteria and selection process that makes these awards so distinctive and coveted. We welcome you, ma'am.
Good evening, distinguished delegates, jury members, ladies and gentlemen, and all the participants in the room. We have been the process advisors and official tabulators for the FICCI Healthcare Excellence Awards since over a decade. And as mentioned by Dr. Bhatia and the esteemed jury panel, we seek to improve, enhance the overall experience with respect to the participation process. As many of you are aware, we have a call for entry process which extends to up to 3 months. So there's enough time for the participants to collate the data, to submit supporting documents for the various initiatives that have been implemented during the period. In terms of the process and procedures, we have, as mentioned by Dr. Bhatia as well, we have an extensive process, and I'll take you through each stage of the evaluation. Firstly, the awards are an initiative which aims to recognize and felicitate organizations and individuals for their contribution to the healthcare industry. We're looking at innovations that have improved efficiency, affordability, more importantly, and improved performance of healthcare delivery at every stage. In this edition of the awards, applications were invited across 5 categories: the excellence in patient service delivery, excellence in patient safety and care, excellence in community engagement, digital transformation initiative of the year, and training and skill development initiative of the year. So these were the 5 main categories, and across these categories, we had subsegments on the basis of the type of organization. We have received an overwhelming response of more than 200 applications across these 5 categories. The awards tonight will recognize winners for each of these subcategories. There will also be certificate of recognition in certain cases as decided by the grand jury members. Our role has been to define the awards process, the categories, the application forms, the evaluation criteria, and also the shortlisting process that is followed for each and every application that comes in. So once the call for entry process begins, EY does the due diligence with respect to the eligibility criteria, the initiative period, the data that is provided as well. Once we complete our due diligence, we then have the interim jury look at all the applications and the supporting documents, collaterals, and on the basis of the information that is submitted, there is an evaluation done on the basis of the initiative, the impact, and the overall delivery. On the basis of the interim jury scores, we determine the top 3 to 5 finalists in each category. Once we receive the finalists for each of the categories, the Astron team led by Dr. Bhatia and his entire on-ground field team actually visit the finalists. They validate the data that has been provided. So in terms of the numbers that is submitted, in terms of the information that has been submitted, there is an on-ground validation that is done. And this is across each of the locations across India. And this is given as an input to the grand jury members for the evaluation. So if the numbers vary, then that is highlighted and presented to the grand jury. What we also do is we share a predefined template with the finalists for their one-on-one interaction with the grand jury. So there is a 10 to 15-minute interaction. There's a detailed Q&A session that takes place with the grand jury members. So we have participants from all over India flying in, and this is an in-person interaction which takes place over 2 days. So there's a lot of effort that the jury members also take. They devote a lot of time for the evaluation as well. And on the basis of the interaction, on the basis of the data that is presented, the evaluation is done to determine the winners that will be announced today. So this is a 5-stage extensive process that is followed for the winner determination. EY has moderated all the jury rounds, and we've tabulated the scores to determine the winners. In terms of interaction, there's always a lot of improvement, feedback that we receive, not only from the jury members, but also from the participants. So it is our endeavor to improve the overall and overall process and to enhance the overall experience as well. It gives us immense pleasure to be associated with the 16th edition of the FICCI Healthcare Excellence Awards. And I would like to thank each one of you for participating and for making this award a huge success. On behalf of Ernst & Young, once again, congratulations to all the participants and the finalists and the winners. And I hope you have a great evening ahead. Thank you.
Thank you very much, Sakshi, for taking us through the entire process. And we await the arrival of our chief guest, Mr. Kapil Dev. He'll be over here in a very short while from now. Till that time, we will have the video of the jury. Thank you.
These awards really show the kind of work that is happening in the health sector, the innovation, the cutting edge technology, all that is coming in. And what is more important is the sense of recognition. Good work must be recognized, must be promoted, and must be rewarded. And that is precisely what these award functions do. The process of choosing is a meticulous one, and only the best get chosen. So we must continue to pick up the best, the outliers, the differentiators, and keep rewarding them so that more and more come in future. I hope we have far more applications next year than this year, and more than that the year after.
FICCI Healthcare Awards have been around for over 15 years. We'll be celebrating the 16th year this year. And when you talk about how are FICCI Healthcare Awards different from the others, I think there's a very serious, exacting process that goes into selecting those who will be considered for the award. 2-day procedure where the jury sits from morning till the evening, where physical presentations are made by those who want to compete for the awards, questions are asked, and really at times there is so much of interaction that happens and brings out things which actually the awardee may not have even thought of. The other way that these are helpful is that they bring the contenders into the eyes of users, the industry, and it helps in fostering relationships, and especially for startups, newer organizations, the connect with the users can be immediate, and this helps them actually in their go-to-market strategy, and it helps the healthcare ecosystem.
It's a great honor and privilege for me to be present at the award function of the FICCI Healthcare Awards. These awards have attained a great significance in the mind of all the healthcare companies in India. And every year we find that many more people with much better quality are applying for. So I think the main benefits of this is that the Indian healthcare industry has come of age, and by the giving of these awards, it will further go a notch higher. So I wish all the award winners a very, very great felicitations for being here today.
It is my good fortune to have been associated with the FICCI Healthcare Awards since its inception. And all I can say is these are not only important for the individual who wins the award or the organization that wins the award, but also it is important for the industry. That your peers are recognizing you is a big plus. This is the only award that at least I am aware of in which not only do you have a preliminary jury which screens it, after the process is checked by E&Y, which is the official tabulator, and then it comes to the preliminary jury, following which the final jury decides, and in between the demands require that the data that you have submitted is checked by an organization such as Astron, which sends its own people irrespective of where you may be located. So it may be in a village setting, it may be in a major city, but this is a very, very meticulous process. Therefore, the value of these awards in the eyes of not only the industry, but also to the individual is massive.
FICCI Healthcare Awards have, over a period of time, become probably one of the most prestigious awards in the healthcare industry. Here's one award category where you have to earn it by what you have actually done on ground. As the chair of FICCI Healthcare Award Committee, it's a proud privilege to say that if we are talking of healthcare awards in the country, we are probably talking of the most prestigious ones, the most honest ones, and the ones which really have that credibility to be called the awards of what healthcare deserves.
It is extremely important that the quality improvement initiatives which are being done at the public and private hospitals needs to be showcased, and somewhere they need to be also benchmarked.
Ladies and gentlemen, please help me welcome our chief guest, Mr. Kapil Devji, for joining us this evening to appreciate and reward the outstanding performers. Hi, sir. Welcome. Hi. How are you? Please, sir. It's indeed our pleasure and pride to have Mr. Kapil Devji here. And we have on the dais the awards jury co-chair, Dr. Harsh Mahajan, Chair FICCI Health Services Committee and founder and chairman, Mahajan Imaging and Labs. We have with us Honorary Brigadier Dr. Arvind Lal, Chair FICCI Swasth Bharat Task Force, Executive Chairman Dr. Lal Pathlabs and Managing Trustee ALVL Foundation. Let's extend a very warm welcome to all of them, please. Thank you so much. And I would now request Dr. Harsh Mahajan to welcome our chief guest, Shri Kapil Devji, with a green certificate. Sir, the green certificate states that 6 trees will be planted in your name at Trees for Ecotourism in Somgo, Sikkim. And I request Dr. Mahajan and Dr. Arvind Lal to kindly present a memento to Mr. Kapil Devji. Thank you very much. And without further ado, I request Dr. Harsh Mahajan to deliver the welcome remarks. Over to you, sir.
Good evening. Mr. Kapil Dev, Padma Shri, Padma Bhushan recipient, who galvanized cricket in this country. Sports became a religion. Much thanks to you, sir. Honorary Brigadier Dr. Arvind Lal, Chair FICCI Swasth Bharat Task Force and Executive Chairman Dr. Lal Pathlabs and Managing Trustee ALVL Foundation. Awards nominees and participants, FICCI Health Services Committee members, partners and members of the media. Ladies and gentlemen, it is a true honor to welcome our chief guest, a legendary figure who has not only shaped Indian cricket, but also inspired millions across the nation, Mr. Kapil Dev. A round of applause for this legendary gentleman. Known as one of the greatest all-rounders in the history of cricket, Kapil's iconic leadership led India to its first ever World Cup victory in 1983, a moment that changed the trajectory of Indian sports forever. His contributions to Indian sports have been recognized with some of the nation's highest civilian honors, including the Padma Shri in 1982 and the Padma Bhushan in 1991. In 2002, Wisdom named him Indian Cricketer of the Century, an accolade that speaks volumes about his impact on the sport. In 2010, he was further honored with the induction into the ICC Cricket Hall of Fame, solidifying his place among the world's cricketing greats. He's also been a role model, using his influence to promote fitness, resilience, and the spirit of sportsmanship. We are thrilled to have him here today as a symbol of inspiration and excellence as we celebrate achievements in healthcare, an arena like cricket, which demands dedication, teamwork, and the drive to make a lasting impression. Please join me in welcoming the legendary Kapil Dev, who also happens to be a very good friend of mine. Kapilji, we are thankful to you for gracing the occasion, even though you had to face the vagaries of the traffic in Delhi and Noida. Your presence adds a unique dimension to our gathering, and we are genuinely excited to hear your insights and experiences with the healthcare sector in India. I would also like to thank our jury chair, Mr. C.K. Mishra, who's been a great pillar of support to FICCI over the years. And under his guidance, the awards jury has selected the winners. He is unable to join us due to some unavoidable circumstances, but would be with us tomorrow. I welcome you all to the 16th edition of FICCI Healthcare Excellence Awards. Thank you for accepting our invitation to share this moment of joy with us, where we celebrate excellence and innovation in healthcare. Today, we will felicitate organizations and individuals for their efforts and exemplary contributions to the sector by innovating for increased efficiency, affordability, and improved performance of healthcare delivery. Those who have made the theme for our awards: inspire, change, together, a way of life at the workplace. As most of you are aware, these awards have emerged as the definitive recognition for contribution to healthcare in the country over the years, based on initiative, sustainability, scalability, and impact, which form the key criteria for evaluation. I welcome you all once again and look forward to sharing with you moments of joy and also seeing what is possible when individuals and organizations work to bringing healthcare to the forefront, those who've helped solve Indian healthcare problems in Indian way. Thank you very much.
Thank you very much, sir, for your warm welcome note. Ladies and gentlemen, today it's indeed our pleasure and pride that we have Mr. Kapil Devji as our chief guest to give more addition of glamour and obviously a lot of hard work what he has done on the ground. We have seen it in the movie 83, and here he is, and we are able to witness his presence. That's indeed, no words can be said so, because he has seen the hard work, and today he's going to appreciate the hard work of one and many. And before he presents the award, we would request him to address the participants in the August gathering over here. Sir?
नमस्कार, गुड इवनिंग। हम स्पोर्ट्समैन को कहते हैं बात मत करो, खेलना सीखो. So I don't know what to talk, how to talk. The worst thing is जब आप स्टेज पे बैठा के किसी की तारीफ करते हैं, ये नहीं लगता तारीफ कर रहे हो या बेइज्जती कर रहे हो. So I always feel कि वहाँ पर बिठा के ज़्यादा बात हमारी नहीं होनी चाहिए. Why we are here, that's more important. The Healthcare Excellence Award you're getting, I think that's more important than I am. I was part of this world which I had, God have given me ability. I perform, and you all recognize that. I'm so deeply humble about that. You recognize my talent. But I think more important is the people who won the award today. I think your wonderful job you've done. After COVID, actually we learn how to live our life. Before that, it was different. But I think COVID, sometime people said that was the worst time in our country, but I said that was the best education I got during that period. And we are the lucky one. A lot of people said during the COVID, unlucky, this is what. I said I was the most lucky person because I survived. The people who are not lucky, they are not with us. So sometimes you don't make money, you don't earn money, but we can achieve much more than that if we are alive. And a lot of credit goes to all of you, the people who are sitting in this room, or your type of people, doctors, nurses, who have worked so hard during that period. We can say, we can see today. The day is so important today. Well done to all the jury members. I think you must have worked very hard to pick up the best out of best. And it's not easy, but inviting me, given me honor to be with you people. मेरे को तो डॉक्टर के स्पेलिंग भी नहीं आते और मुझे बुला लिया आपने. मैं कॉलेज में जाता होता था पढ़ने के लिए, पढ़ना नहीं आता था इसलिए खेलना शुरू किया। तो इसलिए कभी कभी मैं ऐसे अवार्ड्स में आता हूँ तो आई फील वेरी nervous and feel very awkward because I don't think so I have to give award to somebody. I'm not so good. I feel that personally. Yes, I was very good in my field. I think you should have called the people who are great in your own field. But nevertheless, now you invited me, let's enjoy this evening. I think that's the most important. Don't be serious. आप हॉस्पिटल में बहुत सीरियस रहते हो. हाँ, डॉक्टर हंसता भी नहीं है और ऐसा मुंह फेस बना के आता है what to tell you this that. Doesn't matter, yaar. Let's enjoy ourselves. Doctors are here to enjoy themselves also. I know you have a lot of pressure, but sometimes I see on cricketers' face more pressure than yours when they are losing, when they are not playing well. So I think this is a time to enjoy ourselves, the award-winning people, and why not? Celebration, when it comes, we should always look forward. कभी कोई ऐसी चीज़ आती है तो खुश होना चाहिए ना. तो आज खुशी का माहौल है. आई डोंट नो आधे डॉक्टर शैम्पेन पीने देंगे कि नहीं. पीने देंगे ना. ये खिड़की बंद करके आप सब कुछ करते हो और आपको मालूम भी है. Closed door, but that's life. I think I would only request one doctor, tell people to live life. That's very, very important. आपकी बात हम बहुत जल्दी सुन लेते हैं क्योंकि आप डरा बहुत देते हो, डरा भी देते हो. थोड़ा सा कुछ हुआ, डॉक्टर के पास गए और वाइफ किनारे में जाके बोलती है, डॉक्टर साहब मेरी तो सुनते नहीं है, आप इनको ऐसे बोल दो. सारी उम्र तो उनकी सुनते हैं हम. तो इसलिए आई थिंक यू हैव अ रिस्पॉन्सिबिलिटी to bring smile on people's face, which is the most important. We've forgotten that, how to laugh, how to enjoy ourselves. But you people have done a wonderful job in this country. I think our Indian doctors are done well, not in India, abroad also. So well done. I'm proud to be part of this evening, and let's enjoy this evening. Khatam karo jaldi jaldi, फिर let's have a drink. ठीक बात है ना. पहले थोड़ा कुछ खा पी भी ले. इतने दूर से बुलाया, ये भी नहीं पूछा कॉफ़ी पियोगे या सीधा ला के स्टेज पे खड़ा कर दिया. बट आई अपोलोजाइज कमिंग लेट. माई फॉल्ट कमिंग फ्रॉम नोएडा. ट्रैफिक हो या ना हो, आपको टाइम पर आना चाहिए. वो 10 मिनट में इनसे बात कर रहा था. आई रीच देयर, आई विल बी देयर इन नेक्स्ट 2 मिनट्स 3 मिनट. बट वो 2-3 मिनट लेट होते होते 10 मिनट भी. आई फील दैट a sportsman should never be late, and doctor particular never be late. Thank you very much. Enjoy your evening, and let's enjoy our evening.
Thank you very much, sir, for those inspiring words and also for your gracious presence. Sir की speech वो 1983 वाली मैच जैसी लगी जब उन्होंने 138 balls में 175 runs बनाए थे. Agree, guys? Thank you. Thank you so much.
बोला नहीं था.
नहीं सर, आप बोले नहीं थे.
मैं
पर आपकी
speech नहीं दिया.
हमको इंस्पायर कर गई आज.
हाँ, मैंने speech नहीं दिया.
नहीं, आपने
सिर्फ मैंने आंखें दिखाई थी.
अच्छा. Okay, without further ado, we now shall start with the general award categories. Ladies and gentlemen, whoever is coming to receive the award, we are requesting to embark from that side and disembark from here. We start with the general award categories. This year, 220 entries were received from more than 120 organizations across the country. And then the best of the best was selected. We shall announce the winners for one entire category first and then request them to join one by one on the stage to receive the award from the chief guest. The first category is Excellence in Patient Safety and Care, where we have 3 subcategories, beginning with Excellence in Patient Safety and Care, Private Hospitals. Let's have a look at the nominees on the screen.
On the occasion of 16th FICCI Healthcare Excellence Awards, we come together to celebrate and honor the exceptional individuals and organizations that have left an indelible mark on the healthcare landscape. Their unwavering commitment and groundbreaking innovations have not only transformed lives, but have redefined the very essence of healthcare excellence. Nominations in the category of Excellence in Patient Safety and Care for private hospitals are Apollo BCG Hospitals, Fortis Hospital, Banirghatta Road, and Kaveri Hospital.
I request our chief guest, Mr. Dev, to announce the winner, please.
Fortis Hospital.
Congratulations to the winner, Fortis Hospital, Banarghatta Road, for their initiative.
Fortis Hospital, Banarghatta Road.
I am Dr. Chakravarti from Bangalore, Fortis Hospital, Banarghatta Road. Our project is about improving occupational safety among healthcare workers in the healthcare facilities. And many doctors, many industrialists don't know that anesthetic agents, which are inhalational anesthetic agents, which are liquids, vaporized to give anesthesia. And our aim was to improve the occupational safety, because it's not only the environmental safety, but also the gases released in the operation theatre can cause harm to the healthcare worker.
Congratulations, and we request the winner to come later after all the three subcategories are announced. Excellence in Patient Safety and Care, Public Hospitals. And the nominees are
Nominations in the category of Excellence in Patient Safety and Care for public hospitals are UN Mehta Institute of Cardiology and Research Center, Civil Hospital Ahmedabad, and All India Institute of Medical Sciences, New Delhi.
The awards jury felt that a certificate of appreciation should be granted to this category to All India Institute of Medical Sciences, New Delhi. And it is for their initiative creating awareness regarding the Ayushman Bharat digital mission and generating Abha IDs for patients coming to AIIMS. Congratulations. We don't have a video for this. Okay. Next is the Excellence in Patient Safety and Care, Other Healthcare Providers. Let's have a look at the nominees first.
Nominations in the category of Excellence in Patient Safety and Care for other healthcare providers are Dr. Lal Path Labs and Birla Fertility and IVF.
We request Mr. Dev to announce the winner.
काफी जोरों से IVF चल रहा है. Is that good enough, or you want me to say the Birla?
Yes, you have to say. Ma'am, yes, but you'll have to wait. Just give me a minute for that. Congratulations to Birla Fertility and IVF for the initiative, Clinical Excellence, Conception and Care.
I'm Parul. I represent Birla Fertility and IVF, and today I have with me my colleague Dr. Lipsa Mishra, one of the leading fertility specialists from Bhubaneswar.
IVF is associated with some bad things mixing together, so they're not properly aware. On the other side of the coin, there are multiple IVF failure cases where when they ask what has gone wrong and they still don't have any idea, there's no documentation, they don't have the knowledge what embryos had been formed, what was the quality of eggs, was the problem in the male factor or in the female factor. So such cases have made us realize the magnitude of this problem and the unmet need of this population.
Our research over a period of 2 years has shown a significant contribution of this is actually leading to couples either delaying the treatment or not coming forth for the treatment. So our initiative of clinical excellence in conception care is revolutionizing patient care by providing unparalleled transparency and care with highest standards of clinical excellence.
Congratulations once again, and I would now request the winners to come on the stage. Foremost Fortis Hospital, Banarghata Road, for excellence in patient safety and care, private hospitals. We'll request Kapil Dev sir to hand over the trophy and certificate to the winner. We now welcome on stage Birla Fertility and IVF for excellence in patient safety and care, other healthcare providers. Congratulations. And for the certificate of appreciation, which is being granted to All India Institute of Medical Sciences, New Delhi, for excellence in patient safety and care, public hospital. We welcome you. Congratulations. You can be seated. Category 2, Excellence in Patient Service Delivery. We have 4 subcategories in this, beginning with Excellence in Patient Service Delivery, Private Hospital. Let's have a look at the nominees.
Nominations in the category of Excellence in Patient Service Delivery for private hospitals are Gleneagles BGS Hospital, Jupiter Hospital, and HCG Panda Cancer Hospital.
Requesting Mr. Dev to announce the winner, please.
HCG.
Congratulations to HCG Panda Cancer Hospital for the initiative of Daycare Service Improvement Program.
We represent HCG Panda Cancer Hospital from Cuttack, and we'll be taking you through one of the activities which we had done, which is Daycare Service Improvement Plan. The initiatives which we took and the implementation process, we started a data tracking system. Actually, we digitized the entire process. We have certain tools available. So these were put to good use, and December and January were actually the months where the entire team sat and brainstormed and identified each core issue, where each touch point, where things can be improved and where efficiencies can be brought in. So a standard operation procedure was designed. Of course, that was dynamic, and we kept changing it as and when required, and we could find things going wrong. We started giving appointments. The moment we discharged the patient, the next appointment was given. So we had an idea of when the patient is going to come next.
Congratulations. Next, we have Excellence in Patient Service Delivery, Public Hospitals. And the nominees are
Nominations in the category of Excellence in Patient Service Delivery for Public Hospitals are UN Mehta Institute of Cardiology and Research Center, Civil Hospital, Ahmedabad, and Sanjay Gandhi Postgraduate Institute of Medical Sciences.
I request Mr. Dev to announce the winner, please.
ये सब मुझे कुछ देंगे कि नहीं, मैं अनाउंस ही करता रहूँगा. I can change if these people agree. Sanjay Gandhi.
Congratulations to Sanjay Gandhi Postgraduate Institute of Medical Sciences for the initiative, the SGPGI Tele ICU Services.
I'm Professor R.K. Singh. I'm the head of the Department of Emergency Medicine at SGPGI. And this initiative that we are about to talk about is the SGPGI Tele-ICU service. And it was conceptualized during the period of the COVID. And because of me being involved actually in the COVID, in the burnout, so during this period we were conceptualizing as to what will we do if the pandemic proceeds further. So the initiative was because there was a demand supply gap. You needed ICU physicians, but they were not there. You needed them at so many remote sites when there were less trained people there in these areas. So the details of the initiative are that this is an on-site and an off-site ICU teams communicating with each other to deal with the sickest of the patients 24/7. So this project was conceptualized because of these ideas, and we created a hub at SGPGI.
Congratulations. Also, the awards jury has granted certificates of appreciation in this category too. It goes to UN Mehta Institute of Cardiology and Research Center for their initiative, Homographed Valve Bank. We also hand over a certificate to Civil Hospital Ahmedabad for their initiative for brainstem dead organ donation. Congratulations. Next is Excellence in Patient Service Delivery, Other Healthcare Providers.
Nomination.
And the nominees are
In the category of Excellence in Patient Service Delivery for Other Healthcare Providers are Autobok Healthcare India Private Limited, Care Health Insurance, and Nobicity Healthcare LLP.
And I request Mr. Dev to announce the winner, please.
Autobic Healthcare India.
Congratulations to Autobok Healthcare India Private Limited for their initiative of Active After Amputation.
My name is Amandeep Kaur and I'm a prosthetist and orthotist by profession, and I'm working as a Center Manager Clinical Services in Autobok Healthcare. Our mission is to help people to maintain or regain their freedom of movement. So with this initiative, with this mission, we initiated a project called AAA, Active After Amputation. We launched this initiative on 1st April 2022. So what we done in this AAA event, this rehab approach charts a visualization map for lower limb amputees progress and creates an aspiration to achieve more than just walking.
Congratulations. Next is Excellence in Patient Service Delivery Startups. Let's have a look at the nominees, please.
Nominations in the category of Excellence in Patient Service Delivery for Startups are MeadowPlus Services Private Limited, SP Rural India Services Private Limited, and SS Innovations.
And I request Mr. Kapil Devji to announce the winner, please.
MeadowPlus, sir.
Congratulations to MeadowPlus Services Private Limited for the initiative of bringing timely, quality and affordable healthcare to rural India.
Welcome to MeadowPlus. We are a rural healthcare technology company. I'm Neeraj Chandra, the co-founder and CEO. India's population live in villages, but only 20% of medical infrastructure and healthcare is working out of villages. And that too, which is slightly unreliable and of substandard. As a pre-research, MeadowPlus did research in about 7 states. We interviewed 1,600 people in about 400 odd villages. And there was a complete resonance in the requirement of physical interaction by villagers. Now, in the world of technology, we brought a 3-pillar approach. The first one being an innovative and easy-to-use MeadowPlus app, where the symptoms are mapped to the type and kind of care patients may require. Second thing is, then we immediately list the doctors, hospitals, diagnostics right from the tehsil level to district to state headquarter level to complete the pyramidal structure.
And I would now request the winners to come on the stage to receive the award. Foremost, HCG Panda Cancer Hospital for Excellence in Patient Service Delivery, Private Hospitals. Once again, many, many congratulations. Thank you. We now have Sanjay Gandhi Postgraduate Institute of Medical Sciences for Excellence in Patient Service Delivery, Public Hospitals. Welcome. Congratulations. We would now like to invite for the Certificate of Appreciation, which is granted in this category to UN Mehta Institute of Cardiology and Research Center and Civil Hospital, Ahmedabad. Congratulations. Now the Civil Hospital, Ahmedabad. Congratulations once again. We now invite on stage Autoborg Healthcare Private Limited for Excellence in Patient Service Delivery, other healthcare providers. Welcome. And now we invite MeadoPlus Services Private Limited for Excellence in Patient Service Delivery, Startups. Congratulations. Thank you. Gentlemen, you can take your seats, please. Category 3, Training and Skill Development Initiative of the Year. We have 2 subcategories in this category, beginning with Training and Skill Development Initiative of the Year, Hospitals, Health Tech, Other Healthcare Providers. Let's have a look at the nominations on the screen.
Nominations in the category of Training and Skill Development Initiative of the Year for hospitals, health tech companies, other healthcare providers are Johnson & Johnson Private Limited, Kids Clinic India Limited, Cloud9 Group of Hospitals, and Fortis Healthcare Limited.
Requesting Mr. Dev to announce the winner, please.
Johnson & Johnson.
Congratulations to Johnson & Johnson Private Limited for their initiative.
है कहाँ? हमें बहुत सामान चाहिए होता है।
अच्छा, तो सर वो तो
स्पोर्ट्समैन को।
हाँ, बाकी सब मिलेगा कि नहीं मिलेगा? आप इनसे बात कर सकते हैं जब वो अवार्ड लेने आए।
सुनाई दे रहा है तो ठीक है, नहीं दे रहा तो फिर बाद में।
सर सुनाई दे रहा है, वो आने वाले हैं थोड़ी देर में।
नहीं, वैसे थैंक यू कहना चाहता हूँ, स्पोर्ट्समैन की बहुत हेल्प करते हैं। इनका स्टफ ऐसा होता है, कभी कुछ चोट लग जाती है, कोई बैंडेज होती है, तो they are always there.
And sir, he's recorded your speech, so he's more happy than anyone else on the crowd. Congratulations to Johnson & Johnson Private Limited for the initiative strengthening community-based healthcare services for underprivileged mothers and babies in Aurangabad district of Maharashtra.
My name is Dr. Srirupa Das. So I am the country medical director for Johnson & Johnson, and I also look after corporate social responsibility for J&J Private Limited. This is a project where J&J partnered with an NGO, Humana People to People India, and the objective was to strengthen the basic healthcare infrastructure in some districts, in some villages of near Aurangabad. The approach was to strengthen the existing government healthcare infrastructure in those PHCs, the 20 villages that we adopted through upskilling or capacity building of the primary healthcare workers in that area. And this was achieved through various modes of training, providing them with digital tools.
Congratulations. Also, the awards jury felt that a certificate of appreciation should be granted in this category to Kids Clinic India Limited, Cloud9 Group of Hospitals. This is for their initiative Cloud9 Dollar Certification Program. Next is Training and Skill Development Initiative of the Year, Medical Institutes and Colleges. And the nominees are
Nominations in the category of Training and Skill Development Initiative of the Year for Medical Institutes, Colleges are Apollo MedSkills Limited and King George's Medical University.
I request Sir to announce the winner, please.
King George.
Congratulations to King George's Medical University for their initiative, Phase 3 of Regional Resource Training Center, RRTC.
Strengthening of availability of skilled obstetric and newborn care at 5 district hospitals of Uttar Pradesh. So we started this Regional Resource Training Center initiative in 2017. And the phase 3 of the initiative was launched on April 1, 2022. As part of this phase 3, we initially conducted 7 induction workshops to orient 268 faculty across 16 medical colleges of the state about the training material which we had developed for the training. Thereafter, we called the doctors from the 5 district hospitals which are attached to KGMU for training, and then we visited their facilities to assess the facility and to do an on-site assessment of the doctors also.
And I would now request the winners to come on the stage to receive the award. Foremost, Johnson & Johnson Private Limited for the category Training and Skill Development Initiative of the Year, Hospitals, Health Tech, Other Healthcare Providers. Congratulations once again. Would now welcome Kids Clinic India Limited for the certificate of appreciation granted to them. Welcome. Thank you. Would welcome on stage King George's Medical University for the category Training and Skill Development Initiative of the Year, Medical Institutes and Colleges. Welcome. Congratulations. Thank you. You can be seated, please. Category 4, Excellence in Community Engagement. Here we have two subcategories beginning with Excellence in Community Engagement, NGOs, not-for-profit organizations. Let's have a look at the nominees.
Nominations in the category of Excellence in Community Engagement for NGO, not-for-profit organizations are Sankara Eye Foundation India, Sri Kanchi Kamakoti Medical Trust, Echo India, and Siliguri Greater Lions Eye Hospital.
I would request Mr. Dev to announce the winner.
Siliguri.
Congratulations to Siliguri Greater Lions Eye Hospital for their initiative, Community Outreach Initiative.
Myself, Dr. Rajesh Saini, CEO, Siliguri Greater Lions Eye Hospital. We talk about our initiative when we piloted our approach towards providing community eye care services and changing the behavior of the community to access eye care services. And we found that to achieve this, we need to reach to the doorstep. And this particular initiative, everyone in the country found relatively effective when we faced COVID-19.
Congratulations. Next we have Excellence in Community Engagement for Profit Organizations. And the nominees are
Nominations in the category of Excellence in Community Engagement for Profit Organizations are South Health, Amrita Institute of Medical Sciences and Research Center, and Ujala Cygnus Healthcare Services.
And I request Mr. Dev to announce the winner, please.
Ujala.
Congratulations to Ujala Cygnus Healthcare Services for their initiative, Sehat Chopal, Village Healthcare Square. And I would now, okay.
My name is Shuchin. I am the founder director of Ujala Signal. In the Sehat Chopal, we go village to village every day around our hospitals and screen the population for all these chronic diseases as well as infectious diseases like tuberculosis. We are the lead implementers for North Haryana as well as the entire state of Jammu and Kashmir for the TB Mukt Bharat program being run by the Government of India. We are also partners with the Union Against Lung Diseases, which is the lead implementer for TB eradication as well.
Congratulations. And I would now request the winners to come on the stage to receive the award. Foremost, Siliguri Greater Lions Eye Hospital for Excellence in Community Engagement, NGOs, not-for-profit organizations. We would now like to welcome on stage Ujala Cygnus Healthcare Services for Excellence in Community Engagement for Profit Organizations. Thank you and congratulations. You can take your seats, please, sir. Category 5, Digital Transformation Initiative of the Year. We have 3 subcategories beginning with Digital Transformation Initiative of the Year, Hospitals, Other Healthcare Providers. Let's have a look at the nominations, please.
Nominations in the category of Digital Transformation Initiative of the Year for hospitals, other healthcare providers are Center for Development of Advanced Computing, Mohali, Baby Memorial Hospital, Kozhikode, Kovai Medical Center and Hospital, and Malabar Institute of Medical Sciences Limited, Aster MEMS, Calicut.
And I request Mr. Dev to announce the winner, please. Sir.
Baby Memorial Hospital, Kozhikode.
Congratulations to Baby Memorial Hospital, Kozhikode for the initiative Nightingale, AI-powered digital platform for nursing excellence.
Greetings from Baby Memorial Hospital. Nurses play a pivotal role in providing comprehensive and compassionate care. They take the expert opinion or the expertise from the clinicians and provide the compassionate care to the patients. But they spend a considerable amount of time in administrative tasks in terms of documentation, coordinating care, and also doing communication with the various stakeholders. Of recently, what we have seen is also there is a high attrition. Nurses are migrating to West. So this compounds the problem in terms of providing a consistent, comprehensive care to the patients. We have drawn the power of generative AI and various digital tools to enable the nurses, empower the nurses with a platform called Nightingale.
Congratulations. Next is the Digital Transformation Initiative of the Year, MedTech and Device Companies, Software Developers. Let's have a look at the nominations, please.
Nominations in the category of Digital Transformation Initiative of the Year for MedTech Device Companies, Software Developers are CDAC, Noida, Appasamy Associates Private Limited, and Vadvani Institute of Artificial Intelligence.
And I request Sir to announce the winner, please.
I'm a team man. I never like to play alone.
I'm sure, sir.
CDAT, Noida.
Congratulations to CDEC Noida for the initiative ABDA FHIR Connector.
I'm Amarjeet from CDEC Noida, and we are going to present ABDM Fire Connector. ABDM was launched in 2020 as well as in 2021 as a rollout. So the main constraint and main challenge was to all hospital providers to become a Ayushman Bharat digital compliant, to make their clinical records exchanged through interoperability to one hospital to another hospital. And the challenge was that most of the hospitals are using the legacy system where they need to onboard on the microservices, ensure the health standard, and ensure the transportability through Fire Connector. We come out with the initiative of ABDM Fire Connector, which is Ayushman Bharat Digital Mission Fire Connector, which is a utility which can connect any legacy system without ensuring any standard at their end to onboard on the ABDM ecosystem.
Congratulations to CDEC. Also, the jury felt that a certificate of appreciation should be granted in this category to Appasamy Associates Private Limited for their initiative Enhanced IoT-based Digital Imaging System for the Slit Lamp. Congratulations to Appasamy. Next, we have Digital Transformation Initiative of the Year, Startups. And the nominees are
Nominations in the category of Digital Transformation Initiative of the Year for startups are Haystack Analytics and Royal House of Psychiatry Private Limited.
And I request Sir to announce the winner, please.
Haystack.
Congratulations to Haystack Analytics for their initiative Infection Test.
My name is Dr. Anirban Chatterjee. I am the co-founder and CEO of Haystack Analytics. We are a deep tech startup based out of IIT Bombay. We are creating NGS, a clinical genomic solution for detection of infections in diagnostics lab and hospitals. Infection NGS is world's first CE-IVD solution for detection of all bacteria, all fungi, and viruses, and antimicrobial resistance within a turnaround time of 24 hours.
Congratulations. And I would now request the winners to come on the stage to receive their accolade. Baby Memorial Hospital, Kozhikode for Digital Transformation Initiative of the Year, hospitals and other healthcare providers. Congratulations, madam. We welcome on stage CDEC Noida for Digital Transformation Initiative of the Year, MedTech and Device Companies, Software Developers. Congratulations. We would like to welcome on stage Appasamy Associates Private Limited to receive their certificate of appreciation. We welcome on stage Haystack Analytics for Digital Transformation Initiative of the Year, the startups. Congratulations and good luck. Congrats. Gentlemen, you can take your seats, please. We shall now come to the individual awards, which are not applied for, but are nominated by FICCI Health Committees and the awards jury members. And the first award in this category is Chairman's Award for Outstanding Leadership in Healthcare, to recognize individuals who have made exceptional and transformative contributions to the healthcare sector. This award was introduced in 2023 to celebrate the often overlooked champions in the healthcare realm, those dedicated medical and nursing professionals who serve as the driving force behind the success of many healthcare institutions. The award is not focused on clinical excellence, but rather on the individual's administrative acumen and skills, who have pioneered and ardently championed transformative initiatives, yielding significant improvements in the organization's operations, patient care, and overall effectiveness. Let's first have a look at the last year's awardees. I request Mahajan sir to welcome him with a shawl. The trophy awarded by Kapil Dev sir. Can we have the trophy, please? And the citation by Dr. Lal. Can you hand over the citation, please? Can we have a greater round of applause for his unwavered hard work? And sir, you would like to speak a few words? Please. All yours, sir. We'll help you.
dear Shri C.K. Mishra is a good friend and is not here today, esteemed members of the jury, Dr. Harsh Mahajan, Chairman, FICCI Health Services, ladies and gentlemen, I am deeply honored and humbled to receive this prestigious award, and it receiving from Kapil Devji is actually made this even more special. Funnily enough, my son-in-law and my daughter too had honor of receiving accolades from him during their school and early work lives. So this kind of builds a family tradition. Besides sharing his love for golf, we are playing LG Cup together this time, and our zodiac sign of Capricorn. I am 1st January, you are 6th, I think.
That's what my mom said.
She's right. The moms are always right. Yeah. So it's normal for one to get nostalgic at a moment like this. My journey began as a young army doctor, and we have plenty of service doctors present here today, with Gurkhas during the 1971 operation in Shakargarh, which is in Sialkot sector of Pakistan. We managed to evacuate more than 50 casualties from thick of battlefield. I had the fortune of witnessing the valor of Gurkhas in an extremely perilous situation. It fills me with immense pride and joy whenever I have the opportunity to meet the members of my Gurkha battalion. They are very fond of rum, rakshi. So we always had a great celebrations during the Shira. That is this thing. After completing my postgraduate in radiology from Delhi University, I had the privilege of joining the prestigious Institute of Nuclear Medicine, which was known as INMAS, under DRDO in 1980s. There, I helped establish North India's first dedicated imaging center, introducing ultrasound, as Dr. Lal was just mentioning, and India's first breast cancer screening center in 1986. Today, you may find it hard to believe that there was a waiting list of more than a month to get an ultrasound appointment. 7 major institutions of Delhi, Dr. Arun Agrawal is present here from Maulana Azad, he used to be dean there, is to get this thing for almost a month. 7 major institutions, Maulana Azad, G.V. Pant, Ramano Lohiya, Safdarjung, Lady Hardings. They're all serviced by INMAS. INMAS also has the distinction to establish the first MRI of the country. The young and dynamic Harsh Mahajan was also part of this vibrant team. Thank you, Harsh, for this. In 1993, I took a leap of faith to establish a dedicated breast cancer detection center in private sector. This was first of its kind in the private sector. Since mammography was unknown in the country, there was a lot of skepticism regarding its commercial viability. As I look back, I'm filled with satisfaction that I held steadfastly to my dream. But I also had a solid advantage. My rock star of a partner, Dr. Geeta Pant, she's sitting among the audience there. She never let me look back and stood by me and urged in children those early tough years. Subsequently, casual visit to the hills, I belong to the hills, exposed me to the derelict condition of health facilities. This led to the introduction of first mobile medical van having on board facilities of X-ray, ultrasound, lab and pharmacy. The facility was inaugurated way back in October 2002 by the then President of India and my erstwhile boss in DRDO, late Shri Abdul Kalam. The service continues to serve the inaccessible remote areas of National District in Nainital District even today. My love for the hills led me to shape and chair an NGO called ROE since 2013. I am proud of the works we have done in health, education, and livelihood, employing over 150 locals, mostly women. I invite all of you to take a time to visit ROE. It is very close to Mukteshwar. It's a beautiful, quaint little place. And I assure you that it will fill you with hope and inspire you many ways. My sincere thanks to the board members of ROE, our Executive Director, Dr. Pankaj Tiwari, and the entire ROE team for letting me to be a part of this incredible venture. I owe much of my professional growth to my mentor, late General Lakshmipati, whose vision guides me till today. I had the fortune of working with incredible colleagues such as late Dr. Ravi Kashyap. I miss him every day. Ravi's wife is present among us today. Nipun is here. Thank you, Nipun, for making it today. I consider that whom I miss a day, and my patients and their families who fight through despite incredible odds. And since I deal with the breast cancer, there are a lot of fatalities which happen, and it's a very difficult subject to deal. But I consider their absolute trust and love as the best and biggest payback anyone can get hope for. I would like to express my gratitude to my my parents and siblings for their blessings, and to my children and grandchildren who inspire me to build a legacy they can be proud of. A special thanks to Dr. Vinita, my colleague who is not here today, who shares my passion and dedicates herself relentlessly in its pursuit. To Ms. Matthew and Ms. Seema, who have been part of this incredible journey since its inception. Once again, thank you, FICCI, for this incredible honor. Jai Hind. Thank you, sir.
Sir has narrated his thankful note, but we would like to see his life journey through a short video. Can we have the video?
Chairman's Award for Outstanding Leadership in Healthcare, Dr. Colonel Chandrasekhar Pant, VSM. Dr. Colonel Chandrasekhar Pant, VSM, is a distinguished radiologist with a pioneering legacy in breast imaging and extensive contributions to healthcare in India. Currently, he is the senior consultant at Colonel Pant's Imaging Center and director and head of radiology at Fortis La Femme in New Delhi. He is widely recognized for pioneering breast imaging in India and establishing the country's first dedicated and integrated early breast cancer detection center at the Institute of Nuclear Medicine and Allied Sciences, INMAS, DRDO in 1986. His dedication to healthcare also extends to community development, as he serves as the chairman of Arohi, an organization committed to health, education and livelihood programs in rural Kumaon, Uttarakhand. He pioneered India's first mobile medical unit with an ultrasound machine, launched in 2002 and inaugurated by the late Dr. APJ Abdul Kalam, who praised the initiative for reaching remote communities. The unit serves around 30,000 villagers. Arohi also conducts quarterly surgical camps, providing essential healthcare at minimal cost. Additionally, Dr. Pant established the Mrs. Saral Tandon Memorial Center, a safe birthing facility in a remote area of Uttarakhand, benefiting 45,000 people from 55 villages across 3 districts. He has authored several books and received numerous prestigious awards such as the Vishisht Seva Medal by the President of India in 1987, Lifetime Achievement Award by IRIA, and by the Breast Imaging Society of India, Excellence in Radiology Award by Medscape India, and many others. In recognition of his exceptional contributions to radiology and healthcare in India, FICCI takes great pleasure in conferring the Chairman's Award for Outstanding Leadership in Healthcare on him.
Congratulations, sir. And we also have the second winner in this category, or the awardee. I would request Dev sir to kindly do the honors of declaring his name.
Dr. Sanjeev Singh.
We shall have a video of Dr. Sanjeev Singh.
Chairman's Award for Outstanding Leadership in Healthcare, Dr. Sanjeev Singh. Dr. Sanjeev Singh is the Medical Director of Amrita Institute of Medical Sciences and Research Center, AIMSRC Faridabad, and the Chief Medical Superintendent of AIMSRC Kochi. He was responsible in conceptualizing and operationalizing India's largest university teaching 2,600-bed hospital at Faridabad. He is a highly accomplished pediatrician and healthcare management leader with a distinguished career in hospital administration, infection control, and healthcare worker safety. He was a member of Technical Committee at NABH and is presently the co-chair of Research Committee at NABH. He is a member of Drug Safety Council and the National Advisory Body on Occupational Exposures and chairs the National Advisory Board on Vascular Access and Infusions. As external consultant to WHO, Dr. Singh provides expertise on regulatory and licensing policy issues. He advises the state governments on projects focused on improving infant mortality rates (IMR), antibiotic stewardship, infection control, and e-learning. He has 130 plus publications and 14 research projects on AMR, IPC, QMS. He has applied for process patent for his work on antimicrobial stewardship. His achievements have earned him prestigious awards, including the Government of India and QCI's Best Practices in Infection Control 2010, QIMPRO Quality Award, QuimPro Quality Award for Lean Six Sigma 2012, Outstanding Healthcare Professional Award by ITP Publishing Dubai 2014, and the British Medical Journal BMJ Infectious Diseases Initiative of the Year 2016, Best Quality Initiative, DL Shah Quality Council of India and Ramakrishna Bajaj Award 2019, Most Inspiring Healthcare Leader 2021 Economic Times to name a few. FICCI deeply appreciates Dr. Sanjeev Singh's enduring impact on improving the healthcare systems, patient safety and infection control practices and proven leadership, and takes great pleasure in conferring the Chairman's Award for Outstanding Leadership in Healthcare on him.
Congratulations, sir, and we welcome you on the stage. Request Dr. Mahajan to present the shawl. Kapil Dev, sir, to hand over the trophy. And citation. We request Dr. Sanjeev Singh to say a few words on this occasion.
A very good evening, and thank you so much for this recognition and getting it from the legend and the most valuable cricketer at the World Forum. It is a very prestigious thing for me, very honored and deeply privileged, and I would like to really thank both Brigadier Arvind Lalji and Dr. Harsh Mahajan. They have been the mentors, and all the mentors who are here present today. Deeply honored. I just wanted to share a personal moment. I joined Amrita Institute. I got a hug at Vasant Kunj Ashram by Mata Amritanandmayi. I just visited like a fashion. I thought I'll just see who she is. Got a hug and got melted, and she said to join her institution. That was almost 24 years back, and I was building this hospital, which is 2,600 bed at Faridabad. At the inaugural day, I was supposed to explain the model, and it was a dream come true, because when I'm explaining the model, Mata Amritanandmayi is standing there, and that's a dream because you only hear satsang from the hugging saint, but she is listening from your side. Very, very rare occasion, because she's a humanitarian, never visits any of her institution. Her direct disciples were there, who keeps our GPS on track on day-to-day basis. And Prime Minister Narendra Modi, who inaugurated and whom we admire so much. So it was a dream come true, where all three whom you wanted are there, present on your very, very special day. But who was not there? My mother, who passed away 28 years back. My father, who had a prolonged Alzheimer's and unable to recognize me. My wife, who is a professor of anesthesia and palliative medicine and has been suffering for almost 26 years with multiple illnesses and was bedridden. And my son, who is doing his master's in University of California. The point which I wanted to drive is the power of now. And we should not, if we love somebody, we should say it now. We should not store for some other day, because like me, you will miss the bus. It is very important that all the healthcare leaders and champions are here, and the power of now should start. If you think that you can make a difference, it should start now. If you think that quality needs to come, it should start now. If you need to transform, it should start now. And I really would like to dedicate this to my wife for her unstinted and unconditional love and support, and to my team, Dr. Ashutosh, Aditi, and Melanie, who have been just wonderful. Thank you so much.
Congratulations once again. Healthcare humanitarian. To recognize a social activist who has made an outstanding contribution to the healthcare segment in India, a measurable impact in making quality healthcare available in the country without any profit or business motive. Let's have a look at the previous year's awardees in this category. Congratulations to the past awardees. I now request Mr. Dev to announce the Healthcare Humanitarian Award.
Dr. Kiran Martin.
Congratulations, and we shall have a look at the life journey of Madam.
Healthcare Humanitarian, Dr. Kiran Martin. Dr. Kiran Martin is the founder and director of Asha India, a highly respected medical professional and social activist renowned for her exceptional contributions to slum development and healthcare in India. In 1988, she provided critical care using her medical expertise to cholera outbreak patients in a South Delhi slum. This initial effort grew into the Asha initiative, aimed at addressing the broader socio-economic challenges faced by slum communities. With over 3 decades of dedicated service, Dr. Martin has transformed the lives of more than 9 lakh individuals residing in approximately 100 slum colonies across Delhi through her tireless efforts with Asha. Under her leadership, Asha has implemented comprehensive healthcare programs, improved access to education, and promoted women's empowerment, making a significant impact on the socio-economic conditions of marginalized communities. Dr. Martin collaborated with the government to enhance financial inclusion for slum dwellers, recognizing that economic stability is essential for improving health. She was awarded the Padma Shri in 2002. She received an honorary doctorate, the Doctor of Letters, from Sydney University, Australia in 2023. Her exemplary work continues to inspire countless individuals and organizations committed to improving the lives of those living in underserved communities, ensuring that access to quality healthcare is a fundamental right for all. FICCI is proud to present the Healthcare Humanitarian Award to Dr. Kiran Martin in recognition of her tireless service and unwavering commitment to social justice, public health, and the upliftment of the most vulnerable populations in urban settings.
We welcome you, Madam. Please. We'll request Dr. Mahajan to present the shawl to Dr. Martin. We'll request Madam to kindly share a few words.
Shri Kapil Dev ji, our beloved sportsperson, both national and international. Actually, I saw you at the London airport once, and I was standing at a distance. I was in 2 minds. Should I disturb your privacy or should I go and say hello?
Was I alone?
You were alone. And I sort of chose the former.
देखो वो भी डॉक्टर साहब भी बोल रहे गलत बोल रहे थे बंद हो गया इसलिए so
मैंने शायद गलत चॉइस ले ली, मैं थोड़ा दूर हटकर और खड़ी हो गई ये सोचकर शायद आप नाराज़ हो जाएं, सब लोग आपके पास आते रहते हैं. Dr. Harsh Mahajan, of course, whom I've known since we were medical school friends, and Dr. Lal, I don't know if you know this, but you're my neighbor. We live just around the corner from each other. Esteemed guests and dear friends, I stand before you today deeply humbled by this recognition of my work that began over 3 decades ago. The journey that brought me here today didn't start in a conference room or a hospital. It started in the narrow, crowded lanes of Delhi's slums, where survival was the only focus for so many families. In 1988, as a young pediatrician, I entered a world that shook me to my core. Cholera had swept through Delhi, leaving a trail of devastation that more than anyone else affected the poorest of the poor. In those moments, I realized that healthcare could not exist in isolation. People were not just fighting illness, they were fighting poverty, hunger, and centuries-old social inequalities. It was in those slums, sitting under a tree, on a broken chair, that I met my first patient. That single moment sparked what would become Asha, hope, a movement far greater than I could have ever imagined, a movement transforming the lives of over 1 million slum residents in our city. This award, though given to me, belongs to the hundreds of slum women trained by my team as Asha community health volunteers who have fought against unimaginable odds. It also belongs to my doctors, nurse practitioners, and the entire healthcare team, all of whom ensure that no pregnant mother is left without care, no child is born without a chance, no chronic illness goes unnoticed, and no elderly patient is left untreated. Their dedication to providing excellent health care for all with deep compassion has been the cornerstone of my work. And may I add, every single service is provided free of charge. This award equally belongs to the slum dwellers themselves. They are the true heroes of this story. Their resilience in the face of immense hardship, their trust in me, and above all, their unwavering faith in the possibility of change inspire me every single day. Together, all of us have built something that is now recognized around the world, a model that treats healthcare not as a privilege, but as a fundamental human right. Healthcare is not merely about treating diseases. It is about empowering communities. It's about ensuring that access to medicine is accompanied by access to dignity, that the right to a clean environment, to decent housing, and to education are equally important to good health as any vaccine or medication. In honoring me today, FICCI also shines a light on the vital role of humanitarian healthcare in India. It's a matter of great pride that FICCI carries out its own humanitarian efforts all across the country. FICCI's contributions to Indian society have been transformative, uplifting countless lives through initiatives in health, education, and social welfare. So warmest congratulations to FICCI on your wonderful work. I accept this award with immense gratitude in my heart, not only as a symbol of past success, but as a call to continue the work that still lies ahead. Together, let's build a society, one where hope, dignity, and health belong to all. Thank you.
Thank you, Madam. Healthcare Personality of the Year. To recognize a person who has had significant achievements during the past year in terms of business growth, mergers and acquisitions, positive regulatory change, betterment of academia, research, global expansion, etc. Let's have a look at the previous year's awardees in this category. We congratulate all the past awardees. And I now request Mr. Dev to announce the Healthcare Personality of the Year, please.
कि सिर्फ प्रेसिडेंट बन के ही बस पूरा है, थोड़ा काम कर लो आप भी मेरे साथ। नहीं, आपका भी थोड़ा सा होना चाहिए। He is a friend of mine, that's why I take this liberty to talk to him like that. I can't take that liberty to Dr. Saab, you know this.
Dr. Dharminder Nagar.
Let's have a look at his journey, please.
Healthcare Personality of the Year, Dr. Dharminder Nagar. Dr. Dharminder Nagar is the Managing Director of Paras Health, an accomplished and visionary leader in the hospital and healthcare industry. Recognized for his extensive experience, remarkable achievements and unwavering commitment to transforming the healthcare landscape, as the Managing Director of Paras Health, he has played a pivotal role in expansion of the hospital chain, which has grown from a modest single hospital in Gurugram to 8 hospitals across North India. Paras Health, Srinagar, has become the largest corporate super speciality hospital in Kashmir, featuring a capacity of 200 beds. Under his leadership, Paras Health has established itself as a beacon of healthcare services, prioritizing patient-centric care and innovative medical solutions that adhere to the principles of compassion, accessibility, affordability, and quality. Dr. Nagar is the recipient of numerous awards, including the Entrepreneur of the Year Award at India Health and Wellness Summit 2015, the Dynamic Healthcare Entrepreneur of the Year at the Six Sigma Healthcare Awards during the World Entrepreneur Summit, the Medical Entrepreneur of the Year Award at India News Health Awards 2016, Healthcare Personality of the Year 2019 by Medgate Today magazine, Healthcare Icon of the Year at Health NXT 2018, and the Best Healthcare Entrepreneur of the Year Award at 11th MT India Healthcare Awards 2021. FICCI is proud to honor Dr. Dharminder Nagar with the Healthcare Personality of the Year Award in recognition of his transformative impact on the healthcare landscape, dedication to patient care, and visionary leadership.
Welcome, sir. Congratulations and request to share a few words.
Good evening and thank you, FICCI, for honoring me. This is special for me for the one simple reason. There is cricketing heroes here, but my industry heroes sit on this dais and amongst you. आप लोगों को देख के मैं बड़ा हुआ हूँ, आप लोगों से सीखा है और आपने मुझे आज अवार्ड दिया है. It's completely an honor, a privilege, and I assure you I'll continue to work hard और आप लोगों की guidance में आगे संघर्ष करते रहेंगे, बढ़ते रहेंगे. So please keep encouraging me, keep me by your side, and I will do the best I can for Indian healthcare, for healthcare in North India, and hopefully in this journey have lots of fun with all the colleagues and friends out there. Thank you so much.
Congratulations once again. We're now moving to the Lifetime Achievement in the Healthcare Industry. In presenting the Lifetime Achievement Award, we honor an individual who has left an indelible imprint on the Indian healthcare industry throughout their illustrious career. This distinguished individual, widely acknowledged and revered within the health sector, serves as a beacon of inspiration for present and upcoming healthcare professionals, symbolizing the highest standards of achievement and leadership in the field. Let's have a look at the previous year's awardees in this category. Congratulations to them. And I now request Mr. Dev to announce the Lifetime Achievement in Healthcare 2023, please.
When you give Lifetime Achievement Award, you have to stand up and
Yes,
say,
sir.
you know, that means he's very old and he's gone. in a bigger side. Am I right? Yeah, he done. Somebody saying cricket में कपिल आपको Lifetime Award देना चाहते हैं. मैंने कहा हो गया मेरा काम.
अच्छा.
कि Lifetime अभी तो life शुरू हुई है. Lifetime they have to change, but what to do? That's the English people have picked that word. Marshal Pavan Kapoor.
We have a look at his
Air
life journey.
Marshal Dr. Pavan Kapoor.
Air Marshal Dr. Pavan Kapoor, ASM, VSM in bar.
देखिए ये लाइफ टाइम अवार्ड अब आपको शुरू किया है, खत्म नहीं हुआ, क्योंकि लाइफ ही शुरू अभी हुई है. Well done, congratulations.
Can we have the video?
Lifetime Achievement Award in Healthcare Industry. Air Marshal Dr. Pavan Kapoor. Air Marshal Dr. Pavan Kapoor, AVSM, VSM and BAR, is Chairman Steering Committee NABH, Technical Advisor on Medical Education to Ross Education and Honorary Vice Chancellor, Lincoln American University, Georgetown, Guyana. He is former Director General of Medical Services, IAF, and alumnus of the Armed Forces Medical College. He has held numerous significant administrative and professional appointments throughout his distinguished career spanning over 4 decades. He commanded the prestigious Military Hospital MH, established 22, where his leadership ensured the highest standards of medical care and administration. He also served as training officer at the Army Medical Corps AMC Center and College, Lucknow, directing staff DS at the Officers Training College OTC. Within the AMC Center and College, Joint Director AFMS Personnel. His extensive experience and expertise have been crucial in various situations, including the management of natural diseases in Uttarakhand and Jammu and Kashmir, as well as in coordinating responses to the Ebola virus outbreak. A highly regarded hospital administrator, Air Marshal Kapoor is recognized for his pioneering initiative in the AFMS, such as cadre restructuring, manpower augmentation, and automation of AMC records. He has played a pivotal role in developing strategic blueprints for the AMC Center and College, Lucknow, and has streamlined recruitment processes to address deficiencies in medical officer availability. He has received numerous accolades, including the Colonel Pyare Lal Gold Medal, the Order of Royal Emblem from the Sultan of Oman, and multiple Vishisht Seva medals, the Param Vishisht Seva PHS Award in 2016, and commendations from the Chief of Army Staff COAS in 1981, 2004, 2008 and 2016. FICCI deeply appreciates his enormous contribution, extraordinary service, leadership and enduring impact on healthcare industry, which has made Air Marshal Dr. Pavan Kapoor a role model and is proud to confer the Lifetime Achievement Award in the healthcare industry to him in recognition of his remarkable achievements and lasting legacy in the healthcare industry.
Congratulations, sir, and we welcome you. Many, many congratulations, sir. And we request you to say a few words.
And for all the dignitaries on the dais, dignitaries of the dais, my colleagues, my friends, of course, my peers. Well, I think I must thank FICCI for bestowing this honor on me. I must thank the jury for having been so considerate to consider me for Lifetime Achievement Award when I think my life has just started. You see, I am a soldier by heart, soldier by my mouth, so I'll speak the facts, I'll speak the truth. I have certain mentors here, sitting here in front of me, and you'll be surprised that why I'm calling them my mentors, because sitting here in the first row, I have got Surgeon Captain Rajesh Bhalla from the Indian Navy. He's my senior. He has mentored me all through the armed forces, my journey in the armed forces. I have got Dr. Agarwal here. You know, he has taught me the ABC of administration, how to manage in a civil environment, which is difficult for the armed forces people. Well, you know, my journey, you have seen my journey in the armed forces. All I can say one thing is that when Kapilji was hitting that 175 runs against Zimbabwe, I was evacuating casualties in Mizoram, same day, to reach back to my bunker and then hear the commentary that India has won the match. You know, in the armed forces, we learn many things, and all of us who are from the armed forces here, we know that. You see, when a soldier goes to war, he goes to war for what reason? To maintain the territorial integrity of the country, to look after the security needs of the population of his country, for his naam, nishan and izzat. But he also goes to war with the confidence that behind him is a medical support system that were he to get injured, were he to get wounded, there's a system behind which will take care of him, make him fit enough so that he can go back and fight again. That is quality. And when I entered into the realm of quality and when we introduced NABH, we said in this country, when every patient who goes to every hospital with a confidence that I am going there to be healed, to be cured, and my discomfort to be revealed, once our population has this confidence, then this country has achieved quality in healthcare. And with this aim, Yashpal Bhatia and myself, we participated along with Dr. Gyani, who gave the leadership, to introduce and construct the first set of standards for this hospital, and we gave you this organization called NABH. I don't know whether the CEO is here, right here or not, but I heard him in the evening. You see, this effort came not from just one individual. This effort came from a team of people. There are now others like Sanjeev Singh who are heading this technical committee, taking it forward. There are many of you who are involved in this process. My only request is this movement has to go on. It has to go on because the quality healthcare is not the right of the haves. It is also the right of have-nots. So till the time we don't make quality of healthcare reach to the last man in this country, we have not done our job. We cannot have lifetime achievement. Our achievements have just begun. Thank you, FICCI, once again. Thank you, jury members. Thank you, sirs. I can never forget, again, one of my mentors, my teachers, Honorary Brigadier Dr. Avrin Lal. He taught me pathology, and me and Yashpal Bhatia were his trainees in Armed Forces Medical College. So thank you for mentoring us, and thank all of you for being present in numbers to me, encourage me to receive this award, because I thought by the end, most of the people would walk out. But thank you for staying behind. Thanks a lot. Jai Hind. God bless you all.
Congratulations once again, sir. And I would now request all the awards jury members to join on the stage for a group photograph. The award jury members, please be on their dais for a group photograph. Jury members, thank you, all the jury members. Thank you. And I now request Honorary Brigadier Dr. Arvind Lal to give the vote of thanks, please. We request you to kindly sit for just a couple of minutes for now.
Good evening, ladies and gentlemen. Mr. Kapil Dev sir, Dr. Harsh Mahajan, distinguished jury members, all the award winners and nominees, and FICCI Healthcare Services Committee members, partners, and everybody else who's present here today. It is my pleasure and privilege to deliver the vote of thanks on behalf of FICCI at this prestigious gathering of key stakeholders and esteemed guests. We have gathered here tonight to celebrate the outstanding achievements in the field of healthcare and to honor those who have made remarkable contributions, have not only excelled in their own fields, but have also contributed to a larger purpose, raising standards and inspiring change that resonates across this entire sector. The theme of the awards, Inspire, Change Together, truly encapsulates the spirit and sentiments that resonate within the healthcare community. The awards recognizes remarkable achievements and foster innovation and progress in healthcare, and it is our hope that this recognition serves not only as an honor, but as an encouragement to continually push boundaries and set new benchmarks and excellence. I would like to extend our sincere gratitude to our chief guest, Mr. Kapil Dev, for being with us today. Your gracious presence, sir, enriches this occasion, and we are honored to have you here to celebrate these achievements. Thank you for joining us, and once again, let's put our hands together and thank him. I would also like to take this opportunity to express our profound gratitude to our eminent jury members, chaired by Mr. C.K. Mishra and co-chaired by Dr. Harsh Mahajan, who provided their invaluable knowledge, experience, and time in selecting the winners for various award categories. It was not an easy job. I would also like to thank Dr. Yashpal Bhatia, Chair, Awards Core Group, and Chairman and Managing Director, Astron Group. Dr. Ravi Gaur, Co-Chair Awards Core Group, Founder and Director, DRG Path Labs, and Chairman, Medical Advisory Board, Onquist Labs Limited, and Dr. Narottam Puri, who's not here. Narottam is the FICCI Health Services and MVT Advisor, Principal Advisor QCI, former Chairman NABH, and Advisor Medical Operation of Fortis Healthcare. We wish him a speedy recovery. And we thank them for their continued support and guidance in organizing the FICCI Healthcare Excellence Awards. I would also like to thank our process partners, Ernst & Young and Astron Healthcare, who have been supporting this initiative since inception and are very much a part of our growth journey. Congratulations to all the winning organizations and healthcare leaders whose outstanding efforts in delivering quality healthcare, scaling best practices, and driving impactful innovations have set a very high benchmark for excellence. Probably there are no other awards in healthcare as prestigious as the FICCI Awards. So thank yourselves and thank FICCI again. Your dedication to expanding access and improving healthcare standards is truly inspiring, ladies and gentlemen. And lastly, thanks to all the award participants and attendees here. Your commitment and enthusiasm for being a part of this event are invaluable. We are excited to have your support and look forward to your continued participation in making next year's edition even more impactful. So thank you very much.
Thank you very much, sir, for that warm thank you note. And I now request the FICCI Secretariat to kindly join us for the photograph. And ladies and gentlemen, please do not miss out to join us tomorrow at India Habitat Center for Day 2 of the FICCI HEAL Conference.